It's been a year that we have done constant response to the incoming virus, its transmission into community, supporting communities if there are cases or clusters, working with our partners in the province and in the regional health authorities. So we've been very, very busy, and the virus that causes COVID, is everywhere now. And having the vaccine is like getting a huge tool in our toolbox. We've had lots of things before that we've been able to recommend to people in terms of public health actions. Washing your hands, keeping distance, not gathering, those kinds of things have been the biggest tools we've had available to us. And now with the vaccine, we have the big tool. So we have the ability to provide people with a vaccine that can prevent them from getting ill, or if they do get ill, prevent them from having very serious consequences of a COVID infection. There are two approved vaccines in Canada right now, one made by Pfizer, the BioNTech, and the Moderna vaccine. They're both basically the same kind of vaccine. They are an mRNA vaccine. And what that is basically a recipe that we're given as for our bodies to respond to build immunity against the spike proteins that sit on the outside of the COVID virus. And the Moderna vaccine was chosen for distribution in First Nations communities because the Pfizer vaccine was very challenging in terms of having to be kept at minus 80 degrees. It's much more challenging to transport from one location to another. The Moderna vaccine only has to be stored at minus 20, which is about the same temperature as most of us have in our household freezer or in an ice cream truck. And then once it's thawed in the community, it can be kept in a refrigerator for up to 30 days. The Pfizer vaccine only has a few hours once it's been thawed. So it seemed to be a much more efficient way for us to do what we had to do, especially in remote and isolated communities. The new variety, the new variant of COVID, has been found in primarily two locations, in the United Kingdom and in South Africa. Individuals who have traveled from those locations have brought it to Canada. And at this point, the vaccine that we have is still very effective against that variant, but the testing continues. Viruses are known for being kind of moody. They change their coat all the time. They change what they look like a little bit. They change what they act like a little bit. That's why we get an annual flu vaccine. And COVID is no different, that there is variants among COVID viruses in Asia and Europe, for example. But at this point, the only thing we know is that it may be easier to transmit virus from one person to another, but we also know that people don't get any sicker with the new variant. Absolutely. The basic science behind the vaccine has been around for quite a while, and it's used right now in several different vaccines. For example, there's been a change in the vaccine against rabies. A vaccine was developed against the Zika virus, the mosquito-borne virus that was causing so much trouble for pregnant women in the Southern Hemisphere. So the technology behind the virus has been around for a while, or the vaccine has been around for a while. What we do know is that immediately upon identification of this as an important pathogen, something that was going to cause serious illness and potentially death, that serious work was being done to develop the vaccine. There were more than 150 places where vaccine was being developed. The ones that have been found to be most effective are the ones that have gone on to human testing. And they go through 3 stages of human testing for efficacy, for side effects, for protecting people against COVID illness. So there has been a lot of work done. The Moderna vaccine that we're using, there have been more than 30,000 people who were part of the tests that assured us the safety of those vaccines, and Health Canada has done serious investigation just to make sure that everything is safe for all of us and ready to go. I understand completely why people might be nervous. This is a new disease. It is a new vaccine, and we're learning more and more every day. The things that we thought were true a year ago, we've been able to confirm some of those things and find new things since then. But very consistently, the vaccine that's been developed has been found to be safe and strong. There is always a choice about whether or not you accept a vaccine, but not only to protect yourself from serious disease, but to protect everyone around you. And in our First Nations communities, we are especially concerned about our elders, our knowledge keepers and language holders. We want to make sure that we have the advantage of their presence in our lives for a long time to come. So I recommend strongly and support people in their anxiety, knowing that those things can be worrisome, can be a little scary. But I also know that once 70% or more people in the community receive the vaccine, the chances of the virus being transmitted within the community is much, much, much lower. So we definitely want as many people in a community to receive the vaccine as possible. This was a tough, tough decision because we have over 200 communities we need to serve. So we wanted to make sure that we were focused on the most remote communities, communities for whom it is very challenging to access hospital care if they became very ill. We wanted to look at communities who had large proportions of elders living in community. And we also wanted to look at communities who had had experience with the COVID virus in their communities, that individuals or groups of people had become ill and some had passed. We want to make sure that we're recognizing the need for those communities. The harder it is for people to access care, the more likely it is they would be high on the priority list. Those priority lists were vetted between our regional teams and First Nations leadership in those regions, so that there was an agreement on where those priorities lay. Unfortunately, we don't have all the vaccine we need to satisfy all of those early priorities. So we've had to make some difficult decisions. But as soon as we have more vaccine available, more communities will be able to access it. We're working with communities to help make those decisions. Our philosophy for most communities is an all of community philosophy. So everybody over the age of 18, and that's a limitation set by the manufacturer of the vaccine, everybody over the age of 18 would be able to access vaccine. In many communities, the choice has been to vaccinate the elders first, out of respect and honoring who they are in the community. And after that, other members of the community, healthcare staff, including other non-First Nations people who are essential workers in the community, teachers, RCMP officers, and others. But the priority is First Nations resident on those reserves. Right now, about 60% of First Nations people in BC do not live on reserve. And the work that we're doing in partnership with the regional health authorities, we're making sure that there are opportunities for our urban populations to receive vaccination where they live and where they work. Healthcare workers, for example, individuals in long-term care facilities are being given the vaccine as a priority right now. In other places, people who are have unstable housing and are in particular need have been identified as priority populations, and the regional health authorities have prioritized them on their list of priorities as well to receive vaccine when it is available to them. I don't know that we'll ever go back to where we were before this. We have all been impacted in the last year and learned different ways of living and being. Even immediately after you get the vaccine, it'll take 7 to 10 days before your body has developed enough immunity to protect you against COVID. So especially during that period, it's very important to continue with all the public health measures that we know. Until that 75% of the community, on average, has been vaccinated, there is still a risk in the community. So what we don't know yet is whether or not, after I've had the vaccine, whether or not I can still be a carrier of the virus, whether or not I can transmit virus to somebody else who isn't protected during that period of time. So the science is catching up, and as more populations are vaccinated and more people are tested, we will have a better sense of whether or not that occurs. So until we are ready to declare a community, a nation, free of COVID, and being aware that other people who don't live within our community, who may not be vaccinated and still bring infection to the community, until we're assured that that isn't going to happen, we're going to have to stick to the public health actions that we've been doing all along. Washing our hands, wearing a mask when out in public, social distancing, no gatherings. Those are all going to have to continue for some time to come until we can be assured that nobody is going to get sick.